I'm Harlan Krumholz, editor, JACC, professor of medicine at Yale. I'm here with Ania Jastreboff, one of the leaders in obesity medicine throughout the entire world, a great clinician, a colleague of mine at Yale. And I've got a scenario for you that I want to see what you think about. Look, today, the evidence is accumulating about these treatments for obesity. They're remarkable. I mean, it's an amazing win streak. In cardiovascular medicine, I mean, study after study, we had SELECT, secondary prevention, we had STEP-HF and SUMMIT now, showing in HFpEF, and a variety of other studies that are demonstrating that these are consistent benefits across subgroups. It's lowering inflammation. It's in many ways, for at least in heart failure, is causing remodeling of the heart in very favorable ways. I published a paper in Heart that showed that it lowers blood pressure profoundly, and importantly, in patients is also modifying lipids in important ways. Here's the thing. A lot of cardiologists, I think, are thinking that obesity is not in our area and are trying to figure out what they should do. I say, if you know how to treat hypertension, if you know how to treat hyperlipidemia, if you've been helping to modify risk factors and you're thinking about the risks of your patients, then you need to gain the skills in how to use these medications. You need to have a proactive approach to offering for patients living with obesity the opportunity to have their obesity treated and their risk lowered, especially in secondary prevention and especially in HFpEF, where the evidence is, I think, without question, strong. And these are unquestionably going to be in the guidelines soon. And so we can start acting now. What do you think? I mean, where do we stand with regard to cardiologists? What are you thinking as leader in obesity medicine? There's not enough obesity medicine experts in the world to be treating all the people with obesity. So shouldn't the cardiology community be stepping up here and really leaning in to this immense opportunity to improve health?
Yes. I mean, if we think about it, at least in the United States, half of Americans have obesity. A majority of obesity treatment is coming and will continue to come from primary care providers. If a person has more complicated obesity or they're not responding to treatment or not tolerating treatment, yes, they will be referred to endocrinologists or obesity medicine experts, and we're happy to see those patients. I'm an endocrinologist. I have to say, most people with diabetes are not seen by endocrinologists. They are seen by primary care, and then we see the patients who potentially are more complicated. I think the same thing will happen in terms of obesity treatment. Having said that, though, as you said, since the evidence is really mounting in terms of cardiovascular benefit, and as you said, secondary, cardiovascular disease or event prevention, in terms of HFpEF, we have an ongoing trial looking at
sleep apnea as another risk
sleep
factor.
apnea. I know exactly. We have a trial ongoing looking at not only secondary cardiovascular event prevention, but primary prevention in those who are at higher risk. These trials are all ongoing, and some of them have already read out with really remarkable outcomes. And so I think cardiologists have this amazing opportunity. They can actually offer their patients this therapy that can that can really impact them and impact their risk and their health outcomes. If somebody feels like they don't have enough training or enough education about how to use these medications or how to treat obesity, there's many courses online. Hopefully what we're doing now is trying to play a little bit of catch up and bring obesity education into the medical schools, into residency programs, into fellowships, and really expand that. But right now, in this moment in time, what's happened is we have these highly effective tools, and now we have to make sure that those who are interested in using them have the training and the education to use them. But absolutely, I think cardiologists can make such a huge difference. And as I've said before, patients really listen to their cardiologists. And so your words carry a lot of weight, no pun intended. And really, if cardiologists start treating obesity and really start treating the core and primary contributor of all of these diseases that you're seeing, and they can help reduce the risk of a lot of these various outcomes. And that's really what you strive to do. You want to reduce risk.
And just to check one more thing, I mean, my view of this is that this isn't about weight loss, but this is about cardiometabolic health, at least as a cardiologist. I think these drugs have profound effects on cardiometabolic health. So I think they're health promoters, heart health promoters. And I don't just think of them as weight loss. It's just the weight loss is part of it, but But this is about improving cardiometabolic health, lipids, blood pressure, inflammation goes down. I mean, this has multiple benefits with regard to cardiometabolic health.
Yes. And I'll just extend it and say, yes, absolutely cardiometabolic health, but overall health in terms of how our patients are doing. So as a cardiologist, I know that your focus is on cardiometabolic health and the heart is extremely important. I don't dispute that at all, but it's overall health. And the amazing thing is once you help a person, with their obesity, and their life is transformed, it's like you never want to do anything else. At least that's what happened with me. I helped one person, and after that, I was like, "Yep, I'm doing nothing else. This
So I
is
think
it."
cardiologists you want to dig in. By the way, I didn't even mention kidney health. We've also got trials, the FLOW trial,
Yes.
and we published sub-studies of that in JACC. That again, kidney health. So, but you're tapping into something important. I think cardiologists will enjoy the opportunity to use these meds because unlike antihypertensives, people focus on their number, whether blood pressures, but this actually is people lose weight. Many people are grateful, feel good, and for the first time in their life, they're able to gain control over something that despite the fact they've tried and tried and tried, have not been able to, and now with the assistance of these medications can do so.
And I think the great thing about treating obesity and helping patients with obesity is, as you said, they're not feeling their blood pressure in the same way that when I treat someone with diabetes, unless their blood sugars are very high, they don't feel their blood sugars, right? Unless, again, they're very high and then you decrease the nocturia or whatever. But with this, they know they feel the changes very quickly, and I think it really helps with adherence too,
So
because patients will come back if they are
fun,
gaining
right?
back
It's
weight.
fun to treat these patients with these meds because the results are so dramatic, helpful, and the patients are so appreciative. I'm just tapping into this because I think
Yeah.
cardiologists should know we can improve people's cardiometabolic health, but in this case, people are having tangible benefits in many ways.
Yeah.
And I mean, among everything else, it's fun to be helping people so profoundly.
Yeah. I mean, I think there's a lot of um, gratitude. I mean, people's lives are just changed, and I feel very honored that patients would trust me with their lives in this way and with their health. And so I feel very grateful that now we can actually truly help them. And yeah, I think cardiologists will, again, I think if you treat one person, you help them in this way, it's transformative.
Yeah, that's terrific. Thank you so much.